everyone, and welcome to One Tourism World, a convergence point and the global hub for pioneers, entrepreneurs, and visionaries from the global tourism and hospitality sectors. We bring to you an exciting platform featuring distinguished leaders ready to share their groundbreaking ideas on cutting-edge topics that are revolutionizing the industry. Our experts come from very diverse fields, including luxury hospitality, ecotourism, digital transformation, and more, and are set to unravel the latest in industry developments. One Tourism World is a vibrant community here on the One Business World platform that encourages collaboration and open dialogue to catalyze positive change within the tourism and hospitality sectors. Join us in this journey of discovery, innovation, and growth. Let's shape the future of the industry together here at One Tourism World. We are very happy to welcome to the platform our morning, his afternoon, Peter Hult. He's the president and CEO of Vicon. He's joining us today from Sweden. Of course, I'm here with my wonderful co-host, Bertrand Pettit, joining us today from Monaco. And our topic today, Peter's discussion, is going to be on crew health and well-being, which sounds outstanding. Bertrand, let me hand it off over to you for some more specific introductions of Peter. Thank you.
Thank you very much, Glenn. And wow, another one of those One Tourism World webinars. This is becoming a tradition now, but such a success. So thank you, Glenn, and thank you the entire One Business World community. Well, we went through several years of pandemic, right? And we all know that it transformed many of our businesses, and especially the cruise business, right? And so today, we have the privilege of having someone who's probably the expert on crew well-being, crew welfare on board, someone I have known for about 10 years, who I remember when I worked at V-Ships at the time, approached me and my boss at the time and said, you know what, guys, I have an idea. And he was describing what became today the largest operator of medical services on board cruise ships. Not only cruise ships, he also works with other marine industries, but obviously today we're going to be talking mostly about cruise vessels because we're about tourism, right? So he was explaining this wonderful idea of providing medical services on board cruise vessels. He created Vicon, which is based in Florida, and today Vicon is by far the best and the largest provider of medical services on board cruise ship. There's a very good chance, if you've been on a cruise ship, that the medical services are in some capacity operated by Vicon. With great privilege, I'm introducing our guest today, Peter Hult. Peter, welcome to One Tourism World. I think we're going to have an amazing conversation today about crew well-being, crew welfare. What does it mean to take care of your crew on board vessels? We know that working on vessels, working on ships is difficult. You are away from your family, from your support system. You're in a new environment. You're faced with stress, with hard work. So obviously, we also need now to consider how to make your life enjoyable and healthy. So thank you, Peter. And maybe in a few words, can you introduce yourself? Tell us a little bit about your background in the cruise industry and obviously a little bit about Vicon.
Thank you very much, Bertrand. Thank you very much, Glenn. It's a real pleasure to be with you guys today. And I think this is a really important subject that we're talking about today. And while we're all focusing on the cruise industry, the application of remote healthcare, remote wellness for the hospitality industry is really important, be it resorts in the Maldives, having people move into London and provide tourism support in the hotel industry in the big cities as well. So it is something that we all have to contend with. And I think the cruise industry is a really good place to start doing that. It's a ecosystem that is closed, almost like a lab system when you do work in a petri dish. Just to bring it back to healthcare, you can really study it because it's a really confined environment, really exciting. My name is Peter Hult. I am Swedish originally. I used to work in the cruise industry myself in the human resources area. So like Bertrand, worked with Silversea Cruise Line and then was part of the project team and founding team of the World of Residency, which is a condo ship that kind of traversing around the world. And then following that, I was one of the 3 business partners in a insurance group providing employee benefit solutions to the cruise and the maritime industry as a whole, where we really focused on the prevention of health issues. Health risk mitigation is a really important aspect of the insurance industry. And about 12, 13 years ago now, we founded what's today Vicand, which is a global maritime healthcare provider working really in the maritime space, but also into the more remote areas. So anywhere where it's difficult to provide healthcare, that's where Vicand excels. I have about 450 colleagues from 44 different countries in the world. And every day we're providing about 4,500 medical interventions somewhere around the globe. So we have a fantastic team with a great experience, lots of compassion in what we're doing for the maritime industry. So Bertrand, over to you.
Thank you very much, Peter. Thank you very much. And also, may I point out that, well, One Business World loves entrepreneurs, right, Glenn? And I think we have here today, well, a very successful entrepreneur, someone who went from, from the idea, really the inception of an idea, to creating what is today a leader in its own industry. So, talking about entrepreneurship, I think bringing Peter's name is a very good example. Peter, in a word, tell us a little bit about what we are talking about today. What is crew well-being? How do you define what are different aspects of crew well-being that employers should look at today?
So really, to answer that question, Bertrand, let me just start with what are we faced with. First of all, the maritime industry is an old and traditional industry. The cruise industry is a little newer, but we still have a tendency to look at it from an old school mentality. And what I mean with that is shipping companies, cruise lines go out and they source their employees, their crew members from all over the world. One big factor when they source those crew members, outside of looking at experience and skill, is to also prevent any kind of medical conditions to bring them on board. It's called a pre-employment medical examination, where a crew member is going through a very detailed health review, executive wellness check. But this executive wellness check is constructed in a way to prevent people with any kind of chronic diseases to come on board, because traditionally the maritime industry had difficulties in manage those healthcare conditions when they came on board the ship. When a crew member is coming on a ship, it's like a mother. You are responsible for all of the healthcare conditions for your crew, like a mother. You take care of your crew, and that is really important. Hence, the shipping industry took a very preventative approach to reduce the let's say the illnesses or chronic diseases like high blood pressure, diabetes, and so on when they bring them on board. Which is great in some ways. It's just that it has not worked in some ways. And we do want to have healthy crew on board, but we need to work preventative. We need to work proactively to help people stay healthy. And the way we describe this, and for those of you in the cruise industry, you'll all see this, but think about it from the point of view of talking to a chief engineer. Can you imagine if you went to talk to a chief engineer about his most important asset, the engine? Many shipping companies and hotel industry will always say, my crew, my employees are my most important asset. How many times have we heard this? We hear it over and over again. Then you ask them, what kind of asset management system do you have for your crew? What kind of predictive maintenance program do you have for your employees? I know there are some amazing hotel chains out there that are doing a fantastic job, but many are not thinking about the crew and what they can do proactively and from a prevention standpoint to improve the healthcare conditions for your crew. So think back on that chief engineer, and you tell the chief engineer, I don't want you to maintain the engine, only fix it when it breaks. That just doesn't make sense. Same thing when it comes to the crew. We need to maintain and we need to provide prevention, proactive prevention programs, health risk mitigation programs. The cost of having this kind of reactive approach to healthcare is profound. The actual cost where, and Glenn, you may or may not know this, but if you have a serious incident for a crew member, you have to divert the vessel. You have to seek healthcare in some sort of a place. I mean, maybe you're in Miami, but you could also be at a remote island somewhere. It could be a matter of life and death for that crew member. And that's why the team on board those cruise ships are profoundly good and experienced. They're all credentialed according to American College of Emergency Physicians. They're very experienced, but at the same time, why should we leave it to chance for people to have this type of illnesses if we can find a way to proactively reduce the incidence of healthcare needs? And that's why we, in addition to other tools, are focusing a lot on what we call crew asset management, crew predictive maintenance. It is a different approach. Wellness and welfare in general in the maritime industry, and God bless all of my cruise industry colleagues, but we all agree on it. It is a voluntary approach. It sounds like something that will cost the company money. Whereas in fact, when you take care of your employees and your crew, you do it because it is the most important asset. So you need to deploy an asset management program, a predictive maintenance program. And while you do that, you will reduce, and we have data that illustrates that you will reduce your cost to provide healthcare by 75%. And when doing that, healthcare costs can range in the many, many millions of dollars. But we have data that illustrates that you can reduce the cost. Why am I focusing on the cost? Well, I know there's a few companies out there that will do the right thing for the right purpose. But when you can combine the right thing with reduction of cost, it becomes an even more urgent thing. And we can illustrate that today in ways that maybe wasn't possible 3, 4, 5 years ago. We can now illustrate this. But on the other side, and this is another very important aspect, and Bertrand, I'm coming to the application of welfare, but think about it from a safety aspect. In the maritime industry, everything is about safety. Yes, it is guest experience, absolutely, but safety first. And what happens is when you have crew members that have been with a ship owner for, let's say, 10, 15, 20 years, you get to about 45 or 50, where I'm right now. At that point, you start to get chronic diseases. Like it or not, you will have them. You may have a little bit of diabetes, you may have a little bit of high blood pressure, you will start to have the chronic diseases. Because the sensitivity in the maritime industry against those chronic diseases, they will start to exclude you. They have this exclusion strategy to bring those crew members back. As a result, you may lose a lot of people with experience. And when you start losing all those people with experience, you now have to start promoting people with maybe the right experience, right knowledge, but maybe not the right experience, i.e., people get promoted too fast. And when you get promoted too fast, your ability to manage a position is much more difficult. And your mental well-being is being impacted to the point where maybe 1 out of 2 is not able to retain the position because of the mental pressure, not to mention the fact that the guest experience or the operational experience is lacking. So we have this catch-22 situation at the moment where we advocate and where we think that wellness and welfare starts, Bertrand, is actually already at the time of the medical checkup. We don't like to focus on PMEs or pre-employment medical examinations as a prevention tool. We want to look at that as a executive wellness check. Glenn, you're doing one. Bertrand, you're doing one. I am doing it. We get a health baseline, and then we can work with that. And that's what we do, and that is now our experience. We retain people. We help crew members and officers to become crew members for much longer by providing that preventative care, the oversight with a little bit of diabetes and high blood pressure. By doing that, we will never put the ship or the crew member in danger, but we will be sure that that crew member can continue to be a crew member for a longer period of time. And as a result, they experience from both safety as well as from a guest experience standpoint is being retained, which is valuable. I don't know if you want me to take a little brief pause here, but I can continue down this path.
It's fascinating actually, but I point out a few things, and you're right. The cruise industry has been very traditional in its approach to health, right? And we're focusing, almost exclusively on pre-employment medicals, which again are very, very thorough, and probably the most thorough I can imagine in any industries. But two questions here, Peter. First, do you think, and your message is critically important. I think it's vibrant, it's clear, and I can say that we probably all believe in it, because you're right. Being also preventive as opposed to just reactive is probably key. But two questions here for you, Peter. First, do you believe that the COVID pandemic changed the way cruise lines look at that specific topic? Question number two, give us, you don't need to give names if you don't want to, but give us some success stories. Be specific about a success story of something that your team specifically did that reflects exactly the message that you just described.
So just starting with COVID, and COVID, if it was anything good that came out of COVID, is the focus on the value of healthcare in the maritime industry. And that is not just cruise industry, it is across the board around healthcare. The cruise industry and the maritime industry at the time got really focused on mental health. And of course, mental health is an incredibly important aspect. Unfortunately, we got focused on mental health as an application of taking care of crew members when they're going through the crisis period, when they are considering life and death decisions. Our view is that we need to engage on mental health much earlier on. So with the focus that happened in the cruise industry, the acceptance that healthcare is an incredibly important factor of the engagement with their staff, we have now been able to move down the paradigm of providing much more engaging programs for the cruise industry. On the mental health side, we went from no mental health to mental health as a crisis management support to now providing a mental wellness environment where through campaigns, communications, tools, education about identifying vulnerable crew, and opening up easy dialogue with mental health counselors, almost like when you're blowing up that balloon, eventually it's going to explode unless you let a little bit of air out. And our job is to always be available and communicate that you can reduce some air out of that balloon. This is important. Now, I will say another thing that is important on mental health and physical wellness in totality, and what we believe is the most important aspect of problem resolutions, which is an important factor in the maritime industry, and that is food. Food. What we mean with that is, if you have an environment, a ship, a restaurant and whatnot, where the staff feel that they have good food and they want to sit around the table for breakfast, lunch, and dinner, you have problem resolution, you have camaraderie, you create a relationship. So where we get in, it doesn't always have to focus on healthcare, it's the environment and creating good food and a good environment for people to sit around a dinner table to have a conversation. You will have good problem resolution. And with that, you can start to avoid some of those mental health challenges. So it doesn't have to be complicated. It's mind over matter. It's about doing the small things and you will get the big returns. In terms of success stories, there's many, but I will tell you, I mean, if you're talking specifically around COVID, it was a really difficult time. And I'm just going to say that there's no bigger success story than Be Kind. Our team, they did an amazing job working with many hundred of ships, supporting people 24/7, people that they were not doing well mentally or physically. They were all over the world. Many ships were not allowed to dock. Many countries refused ships access to shore and healthcare. It was just a really difficult time. And we had, unfortunately, some sad stories coming out of this that I don't know that we want to go into, but certainly my success story, our success story, was the incredible support our team provided the maritime industry and during this very difficult time. to pull out a specific aspect, Bertrand, I don't know, but it was a difficult time for everybody.
Well, I think Peter, you nailed it. I mean, in terms of success story, I mean, yeah, you're right. You know, the pandemic, with all the unknown that surrounded the pandemic. I mean, no one knew, you know, what was going on, how long it was going to last, you know, what were exactly the dangers. So the information was being trickled down to people, and it was being trickled down to your people as well. Yet, you know, their ability to manage the situation on board. And as you said, Peter, and I want to stress that for the audience, you know, you have ships where you had people that either guest or crew that were, you know, left on the ship and had to stay on the ship until they would be safely disembarked in the port of call. And sometimes it could last several days or several weeks. And then in that situation, the mental health becomes quite critical, and the role of the doctor, the nurses on board becomes even more so important to some extent than the role of the hotel director or the captain. And I have many success stories. I have many specific examples. Again, we're not going to go into that, but of weekend medical personnel who played such a critical role in providing support, not just medical support, but also psychological support to the crew members on board. Sorry, Peter, you want to say something?
I just want to mention, again, I don't want to get stuck on COVID. I hope that we'll never see that again, ever. But the team, so the medical team worked 18 hours a day, 7 days a week for maybe a full year. They couldn't get off the ship. They were understaffed because we couldn't get people to the ships. And many times they had COVID themselves. So they are definitely heroes. There's many heroes during this period of time. And certainly the medical team members throughout the cruise industry was certainly heroes in my mind.
Yeah. I like, so we put COVID behind. Let's go back to today. And I can feel, and you'll tell me, Peter, if this is also your feeling, or you'll contradict me if need be, but I have the feeling that the companies now, the cruise lines, are becoming aware of crew well-being in several ways. You mentioned the environment, you know, and that's, of course, the food, for example, providing, you know, healthy, varied food in the crew mess. But also the activities, you know, what activities do you provide for your crew? The resting hours, you know, how you monitor the working and resting hours, but also small things such as, well, we're expecting those crew members to be away from home for several months, right? Away from their family, away from their friends, away from, in a sense, the world. And yet, up to very recently, we would never provide, for example, internet, or they had to pay for it, which, you know, for some crew members is quite expensive. And now cruise lines more and more are saying now internet should be free for crew members. So that's also part of crew well-being in a sense, you know, providing this environment where the crew member feels that, all right, I'm comfortable here. You know, I can, of course, it's not my home. It will never be my home, but I have new friends, you know, I have new colleagues, and I have an environment that is supportive of me being first productive in what I do, but also happy in what I do, correct?
Absolutely. And I think in every study that is being provided, access to communication and internet is the number one, no doubt. There's many other tools, and there's not one single tool. There's not one single solution that is a silver bullet in itself. But the one category that had the highest impact when it comes to welfare and wellness is the ability to communicate. There is it's called the Maritime Labor Convention that kind of mandates the minimum standards for how we treat crew in the maritime industry as a whole. And of course, the cruise industry is by far better than most when you compare it to some of the commercial ship operators out there. So in this, there is a new application to this law that mandates ship owners to give access to the crew to access healthcare now, starting next year, not for free, but give them access. And many operators are today providing free of charge access to WhatsApp and other tools to communicate. If you want to browse the internet, you may have to pay a crew fee, but it's getting lower and lower. And I will say that with the new satellite services providers coming to market, Starlink being one, access to affordable communication, high-speed communication is very available today, very available, and it's going to continue to become more and more available. So we do see that crew will have access to healthcare in a much more readily way, as well as from our perspective on the healthcare side, our ability to provide remote healthcare is improving tremendously as well, and giving access to crew on ships, direct support, direct access to mental health, wellness, advocates, and so on is improving tremendously as well. So no, that is an important aspect. Another aspect in the wellness. So wellness, there is two aspects. There's one where the crew say, "Oh, this feels good," and then there is the other one that it is good, right? Big problem, and an area that we definitely are doing a lot of work in is in the area of fatigue, sleep, fatigue. We all know, I mean, I'm sure you guys, we all know how we feel when we do not sleep. And some people say, "Oh, I just need 5 hours." Another one is saying 7 hours or 8 hours. But honestly, you need sleep. It doesn't matter who you are. Now, there are certain people that maybe need a little less sleep than somebody else. But there is studies, and I can't come up with the data right now, but where every half an hour to an hour equates a couple of stiff drinks. Meaning, if you don't sleep your required hours, it has the same effect like having a couple of glasses of wine. This is important to think about. And if you're doing this over and over and over every night, of course, you become sleep deprived. And then you have a guest experience issue, you have a mental health issues, you have a security issue. So this is an area that we're focusing a lot of our attention is on the fatigue and on sleep. Sleep is very important. What does 30 minutes extra sleep a night do for you? And I'm saying that to everyone on this webinar. Think about it. So sleep and food is the two most fundamental issues, together with physical exercise. So those are the areas that we're focusing a lot on, without any doubt.
Yeah, I would say absolutely. And sleep, especially on cruise ships, is critical, because if you think about it, you work in the environment where you live, right? So it's easy to sort of forego sleep. And also, very pragmatically, work on ships, and the ship sometimes moves. And with movement, the quality of your sleep is also affected. So whether you accept it or not, it is. I mean, I know I'm never seasick, but if the ship moves, your quality of sleep is affected. And so attention to that is critical indeed. Peter, I'm going to tickle the entrepreneur part of you for a second, because I mean, many of the One Business World audience, but also, my students or the school, international young school, are interested in entrepreneurship, right? And again, as I said at the beginning, for me, you are sort of the entrepreneur, right? You took an idea 10 years, slightly over 10 years ago. It was clearly just an idea at that time, and you took it to the success it is today. Tell us in a few words, tell us how you decided to, going from HR, going from operations on a cruise ship, how you decided to, jump into that idea and manage hospitals on board, which is, if you think about it, which is so critically difficult, but also the liability. There's everything would tell you, no, run away from that, right? Yet you, as the true entrepreneur, you ran towards it. So tell us a little bit about that process.
Well, I mean, I would say this to anyone who is looking to start a new business, and that is, number one, think about what it is that you miss. What is it that you're looking for yourself, number one. And number two, look at what doesn't exist. So when we started Becond in 2009 and 2010, there was a massive problem with healthcare in the cruise industry. It was a big problem. There was a lot of issues going on. And at the same time, we realized that cruise operators are very good experienced creators, and they're very good marine operators. But are they good healthcare providers? Is that really something that when you're operating an experience, a hotel, a resort, a bar, is that something you really want to focus on? So we realized quickly that this was an area that really needed some attention. And it's interesting, we look at the business plan we had in 2010 versus where we are today. It is amazing how we have tracked this business plan completely. I will say one thing, and the reason for that is the cruise industry, like it or not, is the most complicated area to provide remote healthcare to. It is truly complicated. It's complex. There's lots of facets to it. These vessels are traveling around the world. You need to move people around the world to ships that are moving around the world. But what happened when you create that experience, we now could use all that experience and apply it to other maritime and other remote environments. And we can do it with best-in-class solutions with an amazing healthcare team, medical team from all over the world. So I will say, Bertrand, I think when we started looking at this, there was a little fortitude. We did look at it as a business that became its own category almost. But I will also say that there has been a certain degree of luck in the journey, and a lot of wonderful business partners and colleagues. So what we've been able to accomplish could only be accomplished if you have good people that you work with and is your partners. And so the final comment I would just say, Bertrand, be real picky on who it is you partner with. Be really picky. And it doesn't mean that they have to necessarily always be the most experienced or the most knowledgeable, but you need people that have grit, that are willing to see through the difficult times. You need people in your life that are compassionate, that will really care through the difficult times, and then people that you would want to celebrate the successes with as well. So when you do have a success, you need to want to celebrate it with your partners as well. So, but I don't think there is any one way of doing this. I think we all go about this journey in different ways.
Yeah, no, well, a great idea, great people, you're right. But may I add also, because I know you, Peter, a lot of work. And I know Peter works, I mean, constantly, and to be able to balance again, your life with your work is important. And I think you do that, but there's a lot of work behind this. Glenn, may I suggest something? It's if for some reason you feel you need medical help, maybe you should find a cruise ship. Make sure Vicon is on board operating the hospital, and then just book your cruise and get your medical services on board. Right, Peter?
There you go.
Yeah, couple.
Well, hopefully nobody's going to need healthcare, but we're there when people need it for sure.
No, and you're right, but you point this out. On every ship you have one or several doctors and nurses, and obviously, I love when we introduce the officers. The doctor is always introduced, and I love usually they say something to the extent of, "I am probably the person you don't want to see," which is true, in a sense. But at the same time, you also, and this is also the difficulty, to find people that are professional in their field, in the medical field, but people that also are hospitable. You work on a cruise ship with guests, and they host guests, they interact with guests, they have this interaction, and I've met some of the most genuinely amazing doctors and nurses on board ships, because they also understand that, yes, of course, you may have to handle an emergency, and they do that very well because they come from that environment, from the emergency room in hospitals. They know that, right? So they're able to switch very quickly into that mode where they need to save someone's health. But they also understand that, right, I'm also on a ship, I'm going to interact with guests, I'm going to have, a good time with them. So yes, you may not want to see me as a doctor, but you may want to see me as a person. And I think, Peter, the way you recruit your team, I must say, is just phenomenal in that sense. Glenn, a few words.
Yeah. Oh, please, my goodness. Congratulations, Peter, on all that you're doing. As Bertrand said, the key to entrepreneurship is always commercializing the idea, right? Otherwise, it's just an idea. And the fact that you've done such amazing work here in the healthcare space. I wrapped up healthcare administration masters last year, we spent a lot of time talking about the future of healthcare. We did a lot with the treatment or prevention of chronic disease. We did a lot with population health. In a nutshell, you are really the future of healthcare. When you look at healthcare, they talk about accountable care organizations. They talk about value-based outcomes. That's everything you shared with our audience here today. They talk about having a person having a medical home for your crew and for your guests, right? That for that period of time, that's their medical home, and you're achieving that with what you're doing, and the focus on prevention and avoiding and being proactive in your care, right? Getting out in front of it, mental health or otherwise, is incredible. So congratulations on just, I mean, really being a capsule of really what the future of healthcare is. And then you talk about telemedicine and telehealth and the importance of you talk about Starlink or having that kind of access. I've had some personal experiences. My brothers are in the shipping industry, telecommunications, and one had to be treated once in Turkey for a heart defibrillation. And, that was always a scary point. Or I had a priest friend who was the chaplain on a cruise. Hey, great job if you can get it, right? Being the chaplain on the cruise, but he had an issue and they had to take him off the boat in Bermuda, and he had to. So it's something to be out in front of, and what a great story. And I love the fact you bring it back to you put the finance element in it too, right? Asset management system. Mm-hmm. Right. This is a people, but yes, you have obviously all of the physical pieces and the assets themselves, those the cruise ships, the engine room, as you mentioned, but the people part is such an important element of the industry, and not forgetting them or leaving them behind is incredible. So congratulations. Absolutely.
No, it does. Vicon team. I mean, like Peter said, it's a whole team, but they do an amazing job with that. And just think of the fact, put yourself in the shoes of a crew member, right? Imagine if you're home, you have a medical emergency, right? You sort of feel okay because you have your hospital that you know, or your doctor that you know. You have sort of your support system that you're more or less familiar with. You're not going to go so far away from your friends, your family. They can come and visit and so on. You don't have that when you're on a ship, in one of the four corners of the globe. So having someone who truly cares, who doesn't just have the competency, which is important, but also has the approach that Peter was explaining, is critical. I can tell you as a crew member, it is critical, not just again for the reassurance of being well treated, but also for the reassurance of being, well, someone takes your hand, and I really felt that, when you're on a ship and you have a medical emergency, you also need someone to take your hand and say, you know what, you may be in Antarctica, but I'll take care of you. And
Bertrand, if I can just highlight on that. So some people call it bedside manners. I call it compassion. And
compassion.
It is proven. And I think this is an amazing, if anyone wants to look it up, but there is a TED Talk talking about what 40 seconds of compassion can do for you in healthcare. 40 seconds. And 40 seconds of compassion increases the compliance of medical care by 95%. And what is compassion? Mm-hmm. It's somebody, when you go in and visit with a doctor, saying, I understand. I know that you're afraid. Mm-hmm. I'm going to be here supporting you through this. Mm-hmm. And I will always be around when you have questions. And what I really like about the healthcare team at Vicon is they are incredibly compassionate, and we all need to be compassionate. And compassion comes from your heart, from the spirit, not from an application. So either you have it or you don't. And that is an important aspect in all of what we do. So the other thing that I wanted to highlight with our approach, we take this the right way, but we're trying to bring retro medicine back into fashion, meaning the 1950s house doctor call. Do you remember that? Or maybe I don't remember it, but I have seen it in the movies, where the doctor coming biking down the street with his black bag to see the family and get to know all the family members, get to know them. And I think that's something that we have lost in our life when we have to practice medicine in 9 minutes or less. Retromedicine, house doctor call, caring, compassion. And I think that's something that we have an opportunity to do in the maritime industry. I wish that we had an opportunity to do this on a more global basis. I will say that I believe that with technology and using technology to support our healthcare delivery system, I am convinced that we will be able to bring house doctor call and retromedicine back into fashion in a new kind of way. So I'm Glenn, a little bit back to your comment about your healthcare masters. I am super excited with the opportunities that we have for healthcare into the future.
I love the image of the medical bag, and I'm a classic movie fan. So I just had two images. One from Mr. Roberts, right? William Powell was the ship's doctor, and I remember him running around the ship with his little bag. But also Field of Dreams, right? The Burt Lancaster, Moonlight Graham.
That's right.
The country doctor, where it's basic. Let me go to the house. Let me take care of it. What a great analogy! This is
and you know, it's if I may share, I was talking about success stories before, but I wanted to share something that happened to me when I was a hotel director on board a ship, and we had a vacant doctor, a lady, and she was amazing. And the hotel directors, every morning they conduct a meeting for their managers, for their teams, right? And it's usually some sort of, okay, you talk about what happened the previous day, what happens the next day, and so on and so forth, right? And she came and she told me, she said, Bertrand, what about we talk about health as well? And I was like, well, what do you mean? Okay. And she started something that I think they're still doing today. And it was transforming for me. I mean, I know Peter is probably small, but it meant so much for me and for my managers as well. She said, well, before you start your meeting, I conduct the meeting and we do 5 minutes of stretching or exercise or things like this. And it completely transformed it did two things. First, it transformed the energy, which was important. But second, and even more so important, because some people, they were fine of doing all the stretches and things. Some people were not. And it showed those people, particularly, the importance of taking care of their physical health, and I could see over time, those people that initially struggled in doing some of the moves, getting better and better at doing it. And it's all thanks to her. So when you talk about preventive, it goes to those small things, the small initiatives, such as this woman doctor who was just amazing. And again, after she left, that continued. It didn't stop. So thank you, Peter. Well, I think
that's great.
We've covered a lot. We've been almost 50 minutes or 45 minutes together. So I think it's time to bring our wonderful webinar to an end. But I wanted to thank you, Peter, first and foremost, for what you do. I think we're all genuinely thankful, and I'm talking as a seafarer now. We're all genuinely thankful that you had 13 years ago this brilliant idea, and that you had the courage and the persistence to bring it to what it is today, and to make our lives and our health a priority. And we owe to you, in all frankness. And thank you, Glenn. Thank you, Stelios. Thank you, One Business World, One Tourism World. And I may add also, we will have in February a conference of One Tourism World. So we'll talk more about this. Stay tuned. But in the meantime, thank you very much, and have a great day. Thank you again, Peter, and keep doing what you do. Thank you. Bye-bye.
Thank you both.
Thank you, everybody. We appreciate it.
Excellent job. Thank you.